Good morning, everyone. Welcome to today's Meet the Healthcare Professional presentation, sponsored by the Center for Healthcare Careers of Southeastern Wisconsin in partnership with Advocate Aurora Health, Ascension, Children's Wisconsin, and Froedtert Health. As a reminder, please mute your computers as well as your phones so that we don't hear any feedback or any sound that may be going on around you. I am going to be your moderator, and my name is Devonna Williamson. I am a talent business partner at Froedtert Health, and our featured topic today is respiratory therapy, and it is being presented by Froedtert Health representatives. The professionals that will be sharing information today about their career and their field are Randy McClinton and Cathy Stadelmann. Randy, Cathy, thank you so much for joining us today. Can you introduce yourselves, please?
I'm Cathy Stadelmann. I'm a respiratory therapist at Froedtert here. It will be 6 years. We break our department up into service line teams. So the majority of my time I spend in the transplant ICU, mostly with liver and kidney transplants patients. And I think that's everything. I was actually at Froedtert for 8 years. I was a CNA for 2 while I was attending school. So a good way to get some experience in the medical field and find out if you actually like healthcare.
I'm Randy McClinton. I've been a therapist for 6 years as well. Graduated from MATC. I spend most of my time in the medicine ICU. We travel throughout the entire hospital, different floors, every floor basically. I also work in the ED as well. I work with Cathy in transplant, pretty much throughout the hospital. And I love it, actually.
Thank you so much. So what do respiratory therapists do? I don't know that people know what that career is just by hearing it. So what do you guys actually do?
Well, that's kind of funny. I didn't know what a respiratory therapist was either prior to probably 10 years ago. My dad actually ended up with a trach, and doing trach care, that was the first time I ran into a respiratory therapist in the healthcare field. And he battled laryngeal cancer, and after he passed away, like instantaneously, I'm like, I'm going to be a respiratory therapist. And I seeked out a program at Moraine Park, and we do all kinds of things. We, from newborn to geriatrics, so many different patient populations, chronic pulmonary diseases such as asthma, COPD, trauma patients, spinal cord injuries. Randy, chime in. There's so much.
Our transplant patients. Basically, we monitor these ventilators that you see behind us. Mm-hmm. Patients who are intubated, as you guys know, COVID is still ongoing right now. And a lot of our patients, they end up on a ventilator. We also do airway clearance for people who are born with pulmonary diseases. They cannot help themselves. They actually are born this way, and they need respiratory therapy to get through life. So this is one of our devices here. That's the MetaNav over there, if you want to hold it up there.
Yeah, here's MetaNav. So we'll do breathing treatments through this, and it actually offers a vibration. The airflow vibrates to help loosen up the secretions in the lungs as they do breathing treatment. And so is the best. And we use this a lot with our cystic fibrosis patients, and those are those lifetime patients that need help with airway clearance. And you literally, Randy will put on this vest. They do this at home on their own, but then when they're in the hospital with us, we help them with their therapies. Oh, I think I might have to wear the vest. They come in different sizes. But let me plug in Randy. No, I'm not plugging either. But with our and we're in the hospital setting, but there's so many different settings with respiratory therapy. And that's what's really cool about this career is you can work in a clinic. You can do pulmonary function tests and just doing all those tests to determine if they have COPD and asthma and work more in a lab setting. You can be in a rehab center helping somebody get past a cardiac or a pulmonary disease. And then, of course, the hospital setting. There's sleep studies, people who have sleep apnea that snore at night. Respiratory therapists are involved in that. And you go to a sleep study at night and they monitor your sleeping. That is respiratory therapist monitoring that. Home care, patients that are vent dependent, that need somebody to come in and monitor the ventilator. That's the respiratory therapist. So many different avenues and options in this career, which is really awesome.
So I know that we have a variety of careers in healthcare, in the healthcare setting. Yours sounds like a career that puts you in contact with the patient a lot. How much of your time is spent hands-on with the patient? How much of your time is spent like at a computer doing non-patient work?
We probably spend 80 to 90% of our time actually with the patient. There is a lot of charting that goes forward, but for our therapy, we cover so much of the hospital that it's almost impossible to just sit at a computer and actually do computer work.
And our computer work is actually while we're with the patient. We want to document what is going on at that moment with that patient. So we are really documenting the therapies and how they're doing on the ventilator while we're in there with the patient. So it's always kind of a little of both, but it's mostly with the patient.
Great. Wonderful. Thank you. And as a reminder, if you do have any questions, please put them in the chat. So both of you mentioned, one of you mentioned MATC, one of you mentioned Moraine Park. What education is actually required to become a respiratory therapist?
Our minimal requirement is actually associate's degree. That's a 2-year degree in respiratory therapy. Before that, I believe the prerequisites are at least, I was going part-time. I think it took me at least 4 years or so.
Yeah, the most important is getting your biology and chemistry, getting those prerequisites done. I mean, if you went full-time, you have to get all your gen eds done. So work on those right away, get that experience in high school. So when you got to do that college course, you're on it. And then once you get into the program, it's 2 years. It's a 2-year full-time program. A lot of the time, the first year, you spend a lot of book work. But then after that, you spend a lot of time in a hospital setting getting that hands-on experience, which is really where you kind of are putting that book work to your hands-on and practice that clinical thinking skills.
Wonderful.
Yeah, that's the best part. It can be tasking. I know our schools kind of did different types of on-hand. My school required 2 12-hour shifts while I was in school every week for that whole last year. Where Milwaukee.
I remember us doing 8-hour shifts. So you can be in a hospital setting Monday, Tuesday, Wednesday, from morning to afternoon, and then Thursday and Friday you're in the classroom. You know, you were doing both of those things at the same time. You have your instructor that's in the classroom with you, as well as some classmates, as well as shadowing the respiratory therapists who actually work at the hospital. So it's not like we're there by ourselves doing things. We're shadowing our team as well.
So I'm going to ask a question, and I could be completely wrong, so feel free to tell me. But, you know, we've all seen, Doogie Howser, I'm dating myself, but, these TV, see, Randy is laughing at me really hard. we've seen all of these older shows, medical shows, and you see the person being rushed into ED. They're coming in and they have to be intubated, right? The tube going down their throat. Is that the doctor doing it, or is that respiratory?
It could be both.
Okay.
It depends on the facility. We are all trained in school how to intubate. Now, it depends on the facility if they're going to have you, the respiratory therapist, intubate or not. Some hospitals in the Milwaukee area allow respiratory therapists to do it. Others do not. Here at Froedtert, we like to think that we have so many residents here that need practice that they're taking that away from us. So they need to learn that as a doctor. But we are in there for every intubation assisting. And making sure things are going smooth. So we're right there at the bedside with them.
Okay, great. So definitely very emergent cases, but also you had mentioned you have the cases that this is a regular, they're coming in to get some treatments kind of cases.
Yep.
Okay. So what skills, and you touched on it a little bit, but what skills or abilities do you feel would be useful for someone who wants to come into this career? What do they have to be just in general good at?
You have to be good with people.
Okay.
And that's like the very first skill. You have to understand that patients come here, their life is in your hands, and they look to you to know they're comfortable. Good patient interaction. You can't bring your home problems or your home distress to work. You have to be happy all the time. It's kind of challenging at times, but that's part of this job. So when patients come in and they're sick, they may have been sick a very long time. They still want good patient care. So that's the number one thing I believe you have to have.
A lot of communication, respect, compassion. I think you just have to have that really nurturing skill. And I want to say it's a skill because you have to have communication really means listening also. You have to be able to listen to that patient and hear what they're telling you and not be judging them or bringing them down because they are at a very low point. When they're at the hospital, they're really looking for you for guidance and help. And sometimes it is like you have to be happy and you have to be positive with them. They're sick and they just really need all of our support. And it can be draining at times.
Yes, I think I think with COVID being how it is now, family was not welcome. They were welcome, but they could not come in and see the patient.
And
the patient
support.
only had us.
Yeah.
Respiratory, nursing, and doctors.
So
and everyone else, obviously,
right.
In the healthcare field. That's all they had. They can talk on the phone if they're able to, and they can do like what we're doing, virtual meeting with their family. But they relied on us to talk to us, to care for them, and that's like the perfect example.
Another really important thing is time management, because we do deal with we're not just in one place dealing with one or two patients throughout the day. We are all over the place and dealing with 10, 15, 20 patients in a day. And so time management is really important too, because we have to prioritize what patient is more critical. So, can I push this therapy off because I know they're doing okay, but we have to keep in mind, we still need to get around and see all those patients and make sure they are still doing fine, because breathing can change like that. And all of a sudden they're in respiratory distress. So, and that's what we're really trying to avoid.
Great. Thank you. One question did come in the chat that was just really how challenging was it to learn? Is it difficult or hard, your program that you went through? I mean, obviously you worked hard, but I think there's some fear about can I do this? How challenging is the studying and everything?
I always say, if you want it, you can do it. you have to, first of all, you gotta want it, and you have to do it. You just do it. Is it hard? There are hard times. Just like in school right now, you have to study for that test. They're strict, and I know in your program, in my program, you failed one exam. I think we were able to fail one. The second one, you were out of the program and you had to wait another year. So you didn't want to do that. You wanted to put your time in. I think the hardest part for people is the math. Believe it or not, there was a lot of math, but it's not hard math. It's your simple equations. It's just they made us memorize all these formulas so we could pass our board. And then after that, you kind of forget them. I'll be honest with you. After 6 years, I don't know if I remember all of them.
I think the hardest part for me was just juggling. I think it's like, I would tell our younger generation to focus on school and get through school and then try to live life. I was a dad when I was going to school, and I was working a job. So that made it very, very hard.
Yeah, it's that time management.
You have to be at a hospital setting. You have to be in a hospital. We was here at 6 o'clock in the morning. So you have to be able to go to the clinical classes at 6 o'clock in the morning and be there for possibly 12 hours. So it was just juggling your personal life, your work life, as well as school. My program told me, be a full-time student. Do not go to work because you will not get through this program. I managed to do both. Yeah. So it's just really just discipline, really wanting to do it. The program itself, I think it is challenging. I think it is hard. You have to study hard. I would say study to remember. Don't just study to pass a test. Because once you graduate and you're working,
you still need
that knowledge. So study to remember it. Don't just study to pass a test, and make sure you want it.
And I know for me, my instructors were really good. We learned something first semester. We were still reviewing it second semester. We were still reviewing it third semester. We'd get little pop-up quizzes to really drill in. These are important facts. You have to know this. So, and they were excellent. I feel like both, we're preceptors also. So we actually see the students come in and we help them through their schooling. And those programs are awesome. They really are. They support the student. They're very small classes. You stay with that group through your whole entire schooling. So there's 14 students that in my program, and we were study buddies for 2 years, 14 of us. And you work together and you just really support each other and you just keep on practicing it. And everybody's very supportive in the programs.
Yes.
I think when you guys were talking that I think that there may have been a little bit of confusion. So the associate's degree is 2 years. That's how long it takes to actually get through the program. But your Moraine Park or MATC may require that you have certain general education, the gen eds, underneath your belt first before you even get into the program. And that could extend your training.
It could add on, right.
But if you knock some of those things out of the way in high school and do well in those programs in high school, you don't maybe need to take as many gen eds or any gen eds and can jump right into the program. Does that seem right?
It is possible, I believe, if you test out some advanced placement. I want to say chemistry and biology.
Okay. Yes, there is some math, chemistry, biology. Those classes, if you do very well, they can accept those credits. But it's always changing. So don't hold us to it.
I was a returning student. I actually went the other way. I had a bachelor's degree and then I had to go back. I went back to school to become a respiratory therapist. And when I went, I did not have to take biology or chemistry. So I had all the credits, but I still had to take the biology and chemistry to get caught up.
Great. So I know that you've already touched a little bit. We talked about take the science classes, take the math classes, get those things underneath your belt. Are there any other suggestions that you would give to a young person who is considering a career in respiratory therapy?
I would suggest them to see if they can possibly shadow. Look into shadowing us. It does not have to be an all-day thing. It could be an hour. It could be a couple of hours. They can come in. You can schedule time for someone who's off. I'm off. I can come off a day off and come in with a student or a group of students, and I can personally just show them everything we do. And they can see if this is a career for them.
And
Randy, you're going to have people coming in and asking for you, Randy.
Come on in. Randy, come on.
Kathy.
There's the American Association of Respiratory Therapists. Go to the website and see what respiratory therapy is about even there. And
That's the AART, right?
The AARC, Respiratory Care.
Okay.
And again, shadowing, or even if you're really looking to get into healthcare, get in, become a CNA. It's a quick class, and find out if you can really handle patient care. Randy and I were both talking beforehand. I was a CNA while I was in school, working that job, but Randy also said, we were talking about it, nursing or RT, because a lot of times we get confused as nurses. We walk in the room and they're like, oh, my nurse is here. And we're like, no, we're the respiratory therapist. But nursing, we were like, there's different skills. We're working with the lungs. We always like to kind of joke. We're working from the waist up. Okay. We don't have to take care of cleaning up or taking into the bathroom. We actually, I shouldn't say that. We do get them up to go to the bathroom. Just walking.
We assist, but I don't.
Important.
I do not have clean up patients. I will not do it. I can't do it.
You can't do it.
That's the difference. That's what separates us. That's what separates everything. If you don't mind that part of it, nursing would be a great field for someone who doesn't mind it. Me personally, it's not that I won't do it for a patient. I chose to go this route.
And there is still involved with cleanup. When we have a patient that's on a ventilator, we still have to assist. Rolling that patient is really critical because this is an endotracheal tube Randy brought in. He brought in all the gadgets. This is a fake lung here, but this tube is what's in it. That's what we're putting in during an intubation. And if this tube gets pulled out, we're in some trouble because now this patient can't breathe. So moving a patient even in the bed can be risky, and this can get pulled out. So we're there, and we got to make sure that the patient's safe. So even cleaning up, we still have to do it.
Wonderful. Thank you. So before we get to the quiz, one quick question. Well, it's a two-parter. What do you like most about your job? And what do you like least about your jobs?
Randy, you go first.
What do I like most? I like everything, honestly. I like taking care of patients who need us. The patients that come in who have pulmonary diseases, they know the difference between us and a nurse. They never get us confused because they've been seeing us all their life, or most of their life, or a bunch of years of it. I like managing our ventilators here, as you can see from behind me. If you guys don't mind, I can demonstrate for you.
Sounds good.
This here is a test run. It's attached to an endotracheal tube, as you can see here, attached to our circuit. This is our ventilator. This is a dragger that we use. This is probably our most common vent that we have here. I'm going to hit the start button. As you can see, basically this stimulates the lung. Any settings I put inside this ventilator, it's going to be demonstrated through this lung. I have it right now on a respiratory rate of 20. Let me show you 30. There's a difference.
See that good?
So this is what I like the most. I like to manage the ventilators. I like our patient care. Even doctors that come in, they have to have experience as well. If they come in fresh from school, they look to us. This is our expertise right here. They can have all the training, all the education, but so do we. We have experience. I cannot tell you how many times I stood by a doctor's side and they lean on us to get them through a patient because they have not seen certain disease paths, I should say. We have different modes. Some doctors are very comfortable with this mode that this patient is on right now, but there are different modes on this ventilator that the doctors, they're not so familiar with. It just depends on their training, their role, their education path. They look to us and say, this patient is not doing well on this mode. What do you suggest? We have to be ready to answer that question, demonstrate it. If the patient is still not doing well, you have to troubleshoot. You have to be ready to go back on your feet and be ready to be there for that patient.
Do you sometimes make a suggestion before the doctor? Okay, before the doctor even. Okay.
And I have to add, like for Randy, managing the ventilator is the majority of my job, especially working in the transplant ICU. And what's really exciting for me about managing the ventilator is I have patients that are being ventilated for a very long time, honestly, for months sometimes. And we are giving them full support, giving them a high rate and supporting every breath they take. And then my job later on, once they get their transplant, is to wean them off that ventilator and get them breathing on their own again. And it's a process, but it's very rewarding being able to get them off the ventilator after such a long road of being sick.
So is that maybe your favorite part of it?
I would have to say, and actually working in transplant, like I said, I see patients for a very long time. They're there for months. I've had patients in there over a year. And I really enjoy getting to know the patients and the families and truly taking care of them and seeing that road to recovery. That's very rewarding for me.
Okay, well then I need to go to the least favorite then. What's the most challenging or least favorite aspect of the job?
My least favorite is Cathy's favorite. Honestly.
Yeah.
I don't like the attachment. I think it's very, very painful. It's just really hard. Cathy grows with the patient. She gets so many compliments and it's rewarding. And I understand it. But for me personally, we do have our attachments. We have our pulmonary patients that come here all the time. And we can't help but to get attached to them because you have to go see them. But that's a really, really hard part. This hard part for a lot of people. We've had RTs that, you know what, it's not for me. I'm going to do home care or go to a smaller hospital maybe because it's just really hard on your heart to watch them slowly get worse and maybe pass on. So that's a really, really hard one. But the reward is you watch them get better and come off the ventilator, like Cathy said. This is full support. I can change this vent mode to what Cathy knows, pressure support. And when a patient is able to breathe on their own,
so it's not going to take a breath until I initiate it. And the patient actually uses their respiratory muscles and initiates the breath. And then it will support my breathing. So it's going to make sure that I'm going to get enough air, but it's not going to make me breathe. I actually have to use my lungs and use my respiratory muscles to make
it's more giving you something to help judge if they're doing it and assessing their ability.
The patient has to trigger that breath. If the patient does not trigger that breath, it will not.
It's not going to do anything.
It has a backup setting, apnea setting. If the patient does not breathe for a length of time, it will kick up into a backup mode, and it will start to support that patient. So it's not like you have to stand there and watch them not breathe.
So if I stopped breathing here, and so the ventilator eventually will go there, it just kicked in. Said, now it's going to do the work for me because I gave up. I said, I'm too tired for this.
I'm too tired to breathe. Okay.
Yes.
No, I get it. I get it.
So we go back to the doctor. We'll say, hey, they're just not ready for it. Yeah, let's put them back on full support.
Great.
Yeah.
Well, so before we go on to the quiz, since we have heard from Randy what his least favorite is, Cathy, what is yours?
I love every part of my job. And honestly, even it is very, very hard being attached. And like I said, in my unit, I see these patients for a very long time. And I see a lot of patients go to end of life. And I had to learn to find comfort in that. It's okay. Because you do get attached and you want the best for each patient. And sometimes you have to realize that is the best choice for them because they have been really struggling.
Great.
And that can be the most challenging part. And for us as respiratory therapists, we're the ones who have to pull that tube out.
Okay.
So
thank you. Thank you for sharing that. Yeah. Thank you for sharing that. That's an important thing for people to be aware of. Thank you. So, thank you so much. We just have a couple more questions here. Wanted to ask one that came through. I know we talked a little bit about, doing data entry and how much time is spent, at the bedside or at the side of the patient. Just how much paperwork do you guys have to do, or is it just really kind of interspersed with your other work?
No paperwork. It's just charting, really.
Electronic.
We might throw a note in after seeing a patient, so we know that it is communicated to the team. But no, paperwork is maybe making a list of the day of what we want to make sure we get accomplished.
Yeah, everything is done. The electric charting. It depends on where you work as well. I did do a rotation at a different hospital where they still have the charts that you might see on a TV show stacked up inside of a nursing station. But it's very minimal. Most of it is just a signature and maybe a procedure you may have done or something of that nature. But everything is electric charting right now.
Okay, great. Wonderful. So we talked a little bit about the doctors and the new doctors, the residents, and interacting with them. What other kind of medical staff do you guys work with through the day?
Oh, everyone. Within nursing, of course, we work with them a lot. The physical therapists, we sometimes coordinate walks with the patients because we also do what we call home oxygen evaluations to determine if a patient needs oxygen at home. And that requires some walking. So sometimes it's beneficial to have the physical therapist with us if the patient is having a hard time walking.
Everybody from the X-ray team, our X-ray team, radiology. We have our CT scan techs. We have our MRI techs.
Yeah.
We have, like you said, different people from physical therapy, occupational therapists,
speech
therapists. Mm-hmm. They do swallow studies. Some patients, they have to relearn how to swallow without the fluid or food going into their lungs, which is called aspiration, and possibly getting sicker or re-sick again. Everyone thinks if you watch TV, nurses and doctors, that's all you see, nurses and doctors. There's a whole lot of people. There's EVS, there's our housekeepers. They do a wonderful job keeping the place clean. So when the patient leaves, they clean that room make sure there's nothing left behind for the next patient who comes in and could possibly get sicker from what the previous patient left behind. Like, they need the credit as well. So it's everyone. It's not just nurses and doctors.
Great. Thank you. I think that's important for people to know as well. So is there a big demand for respiratory therapists as a career?
Oh, yes. It is a growing field. And I believe they're saying it's going to be a 20% increase need for respiratory therapists over the next 10 years, I believe. Over the next 10 years, we're looking for 20% growth. Honestly, we're constantly growing. I feel like we say we're finally up to staff, and we still need more. So
the hospital is getting bigger.
Yeah.
So you need more staff to cover the hospital. Hospitals are always being built. We have travel RTs. You can travel throughout the country or throughout a state. There's many fields in that area. I mean, there's no ceiling. You can do a lot.
Yeah.
Wonderful. Thank you. Thank you so much. And then you had mentioned this before, but can you just kind of run through it again? I know you had said, obviously you guys work in hospitals, and I think you mentioned that you work in clinics. What are some of the others? Do you guys work in schools? I think you work in homes. Can you?
Oh, I wrote a whole bunch down.
Okay.
I wouldn't forget, because there are so many. Pulmonary and cardiac clinics. So that's more of a clinic setting. We have pulmonary function labs, sleep centers. We went over the hospital settings with inpatient care, ICUs, emergency rooms. All these, now this new thing is with these little hospitals, emergency room departments that are just, having little emergency departments. Urgent cares are becoming.
So she mentioned pulmonary function testing. Let's tell them what that actually is.
You go for it.
That's basically a lab where anybody with any pulmonary diseases can actually go in, maybe on a routine checkup. And they basically test their lungs. If they're doing great, fine. But if they're not doing so good, a doctor will say, hey, it's time to go in. Go into the hospital, let's see what's going on. So there can be an RT there that actually runs that entire process. Asthma as well. We have asthma clinics as well.
Yeah.
Sleep study clinics where patients come in and they do a sleep study. You basically fall asleep, and they can see if you have any issues while you're sleeping, such as if you stop breathing.
Snoring and stop breathing, those pauses.
Which is where this comes into play. So this is non-invasive ventilation. This is for our patients who do have OSA. They stop breathing when they're sleeping. This is a device that they can choose to wear. Most doctors will recommend they wear a CPAP at nighttime, and basically it straps onto the face. It gives them positive pressure continuously while they're sleeping. It keeps the lungs open, keep that airway open, so they can keep getting oxygen and air while they're sleeping.
Sometimes can be a noisy machine, but it's much better than not breathing. Great. Wonderful. Well, thank you so much. Randy, am I correct? But is your shirt having an outprint of a lung on it?
It does.
So, okay, first of all, that's really cool.
Tops. You can wear t-shirts, lungs. We have respiratory on the back. We have different, you can have a heart, you can have a liver, you can have kidneys. If you can have the brain, you can have a spinal cord, it's everything.
That's very cool. Very cool. Yeah, I've never seen that before. So I don't see any more questions coming in. If you do have any, just, put them in quickly. We're heading towards the end. I have interviewed people before who, want to become respiratory therapists with Froedtert. And one of the things that I was told is that, I wasn't positive if I wanted to be a nurse or if I wanted to be a respiratory therapist. But when I walk into the room as a respiratory therapist, they are always happy to see me. And that is one of the reasons why, I chose that career. And I've heard that from more than one person. So definitely thank you guys so much for what you do for people, especially, it's been great no matter any time. But during COVID, you guys have been ultimately so important to people's health and keeping them alive and letting them have some dignity. Thank you for what you do. We appreciate it. But we're all done. We're all set. Thank you so much, Cathy. Randy, anything final that you wanted to say?
No, just really, if you're interested in respiratory therapy, don't worry about the schooling. It will happen. Just dedicate your time to that and you'll get there.
Great. Wonderful.
I would say go straight to college. Go straight to college. Go straight from high school to college. Figure out what you want to do. If you want to become a respiratory therapist, call us. We have numbers here. Say, hey, do you mind if I come in for an hour and shadow a respiratory therapist and see what you guys do if you have time? I would gladly take on some students to show them on my own time, to show them exactly what
we do it all the time.
Thank you so much. Thank you again. I want to thank everyone for attending today's event. If you do have any questions that you want us to get to Randy or to get to Cathy, you can send them to joan.ward@employmilwaukee.org, or you can reach out directly to the Center for Healthcare Careers. And I know your teachers have that contact information as well. And we will get those questions off to, obviously this wonderful team to see if they can address them for you. But thank you again, everyone, for coming today. And thank you, Cathy and Randy, for taking time to chat with us today.
Thanks,
everyone. Thank you.
Bye.
Bye.